Another electrical piece of equipment that we would use during massage, if the client required it, is the audiosonic machine, which uses sound waves. So this machine is excellent for pain relief, sending sound waves deep into the tissue and working on those aches and pains or any problems the client may have. This machine is can normally be used anywhere on the body and is perfect for clients who have sensitive skin as well, because basically it doesn't do anything but send sound waves. It's very gentle, it's very light, and there's no contractions that's connected to it. So this treatment is for any client and you can use it on any client. So the attachments that come with this machine would be a flat head attachment and the round head attachment. The flat head attachment is going to cover large areas. It's going to do the larger areas, but you can imagine you can't do a full body with this. It would take you a great deal of time. So this is for small concentrated areas around the scapula and any areas where the client is experiencing pain or discomfort. The round one is to get into much smaller, deeper areas. So once again, around the scapula, this will work beautifully to get deep into those nodules and knots. So you do not push heavy on this. If you push heavy on this machine, it will stop working. It literally gently glides and you go very, very slow. You need to allow a time for the treatment to work. If you go too fast, you're just skimming the area. So very, very slow. On top you have an intensity dial, so it can go up and down. You can't do a lot of damage with this. I normally have it quite high when I do my treatments because it's a beautiful treatment and it's much more effective. So these attachments are screwed on, but they are on a spring. So when you take them off and on, you press them in and rotate it, and then it will screw off. When you put it on, you just screw it back on. So to take them off, press in the spring and then rotate it. I normally work with the big head first, this one, and I've just pressed it in so you can see how it detaches. So I normally work with the big one first, cover my larger areas, find the knots and concentration areas, and then go on to the bobble one there, which really gets into the smaller areas for me. So as we said, we have a dial there for intensity, and on the inside we have a dial here which actually turns it on. You have two concentration speeds, although speed probably isn't the right word, it would be intensity. So you have 1 and you have 2. So if it's a first time client, you may start on the 1 and then obviously work up to the 2. So this machine, if the client hasn't got specific concentration areas, I would normally use this around the areas where the client gets most tension. So around the trapezius muscles, the upper back, the scapular area, all around those areas where the client feels knots and tension most of the time. So on doing this treatment, you would remove the lamp, should you have done the lamp, and it is much more effective for the client if you have used the UV lamp before doing this treatment because it will warm the tissue all the way through. You would start your normal routine, so you would do your 6 effleurage followed by your spinal work, your massaging of the upper back, and then you would prepare the area that you're working on. So you would do some concentrated effleurage on the area that you're working in our case specifically the scapula, and then we would replace all of your deep tissue work with your hands to using the audiosonic, which will keep you still in your time frame for completing a full body massage. And then once you've used the audiosonic, the flat head, change to the bobble, do both sides again or the whole area that you're concentrating on, then you can put that aside and you can do some effleurages again to keep the area nice and warm. Continue with your full back massage after that, or the massage on whichever part of the body you've used your audiosonic.